dive.
Yeah.
Today we're going to really wade into some murky waters. We're talking about the American healthcare system.
Yeah, it's quite a hot topic,
We've got,
especially these days.
a whole stack of research here.
Yeah, absolutely.
Firsthand accounts,
Mm-hmm.
expert analyses, even some potential solutions.
Hmm.
We're going to try to make sense of it all together.
Yeah, this is going to be a deep dive indeed. I mean, the recent killing of United Healthcare CEO Brian Thompson,
Yeah,
while obviously a horrible act,
of course.
it really does bring to the surface a
Yeah.
lot of these simmering frustrations and anxieties that I think people have about this system.
Right, and it reminds us that we're not just talking about policies and numbers here.
Right.
It's about
People.
people's lives,
Yeah.
their well-being,
Mhm.
and some very real fears
Yeah.
about getting the care they need.
And what's been really interesting is the number of former insurance company employees that are coming forward and sharing their experiences and kind of shedding light on some pretty troubling practices.
Like Natalie Collins,
Yeah.
who worked for United Healthcare for a while.
Mm-hmm.
Her account is really eye-opening.
Mm-hmm.
She talks about this intense pressure to deny claims.
Right.
It's almost like they were trained to find any excuse
Yeah.
to say no to people seeking help.
I think her story really highlights this feeling that a lot of these companies have where, profit trumps patient care in many cases.
Yeah.
One of the examples she gave was this widow who was denied coverage
Oh, wow.
for her husband's hospice care after he passed away from pancreatic cancer. Just a heartbreaking situation that really speaks to the human cost of these kinds of practices.
It makes you wonder, how often this kind of thing is happening.
Yeah.
How many people are just silently struggling?
Yeah.
Absolutely.
Practice denials.
Yeah. And it's not just her. Wendell Potter,
Right.
a former Cigna executive, has also spoken out,
Yeah.
corroborating these accounts, essentially confirming that these companies often delay or even deny essential treatments until public pressure forces their hand.
Until they're forced to, basically.
Yeah.
Yeah.
It's really disturbing.
And then we look at, this kind of growing resentment and anger
Yeah.
that people feel toward the system.
Absolutely.
Bloomberg reported that the 500 wealthiest individuals hold trillions of dollars in wealth.
It's an insane amount of money.
And yet we have everyday families struggling to pay for basic health care.
Just trying to make ends meet.
They're hit with these massive premiums, high deductibles, this constant fear of a medical emergency wiping out their savings.
Absolutely.
It
feels like a real disconnect.
It does feel like a disconnect. That's right.
Right.
A real sense of unfairness.
A real sense of unfairness.
Yeah.
And especially when you consider that, people are diligently paying their premiums.
Yeah.
Doing everything by the book.
Right.
And yet they're still denied the care they desperately need.
Right.
It's just, it feels wrong.
It feels like a fundamental brokenness in the system.
Yeah, a betrayal of trust almost, And then you add in the stories about these exorbitant hospital charges, the $50 Tylenol or the $20 Band-Aid.
Yeah.
It just feels absurd.
It's almost comical if it wasn't so serious.
Yeah, right. It's like, are you kidding me?
Right.
But it's a real thing.
And it's part of this whole cyclical problem, right? Where hospitals are inflating their prices, knowing that they're going to negotiate with insurance companies.
Right.
And then the insurance companies turn around and either deny claims or pass those inflated costs onto the patients.
Through higher premiums.
Yeah.
It's like everyone's trying to protect their bottom line. And the patients are the ones who end up paying the price.
The patients always get stuck in the middle.
Literally.
Yeah, it's a tough situation.
Yeah.
For sure. And, the lack of transparency in the system doesn't help.
Right.
People often have no idea what their treatment's going to cost until they get this massive bill, often with confusing jargon and these inflated charges that are really hard to dispute.
Yeah, especially after the fact.
Right. Yeah, it's like, what are you going to do?
Yeah, and it's especially worrisome, I think, in those emergency situations.
Oh, absolutely.
Where you don't really have the luxury of, comparing prices or questioning charges.
You're just at the mercy of the system.
Yeah, you really are.
And that vulnerability can be incredibly unsettling.
It really can.
It makes you wonder how we even got here.
Right.
How did we end up with this convoluted and often unfair system.
Yeah.
To really understand that, we have to look beyond just the immediate issues and really delve into the historical and political forces that shaped American healthcare.
Yeah, it's a complex history for sure.
It is.
But understanding the root causes feels essential if we're ever going to find any viable solutions.
Absolutely.
Yeah.
Now, amidst all this frustration and despair, there are glimmers of hope.
Okay.
There are calls for reform, and there's a growing movement demanding better.
Okay, so what does that look like?
Well, it's important to remember that while violence is never acceptable,
Of course.
understanding the deep-seated anger and desperation behind it can really be a catalyst for change.
Yeah.
You know, it's about transforming anger into action, turning pain into purpose.
So what are some of the solutions that are being proposed? What are people actually advocating for?
There's a wide range of ideas on the table. Everything from strengthening federal regulations to exploring state-based single-payer programs.
Okay.
Some people argue for more incremental changes, like increasing transparency in hospital billing and strengthening patient protections against these unfair denials.
Okay, and are we seeing anything actually happening?
We are.
Like, is anything actually...
There are some interesting experiments happening at the state level.
Okay.
Places like Vermont and Washington. They're trying out different models of healthcare delivery and financing.
So they're kind of challenging the status quo.
They are.
Forcing us to kind of rethink our assumptions.
Exactly.
Okay.
They're looking at ways to shift the focus from profit to people.
Okay.
Prioritizing well-being and access over corporate interests.
And even if those larger scale reforms take time to implement, are there things we can do?
Oh, absolutely.
In the meantime, to at least address some of the more egregious issues?
Things like increasing price transparency. So people actually know what they're getting into before they receive treatment.
Right.
Or tightening regulations on insurance claim denials.
Okay.
Ensuring that they're based on legitimate medical reasons and not arbitrary cost-cutting measures.
Yeah, these are crucial steps towards at least mitigating the harm.
Absolutely.
While we work towards those more fundamental systemic changes.
Yeah.
Because at the end of the day, healthcare is a necessity. It's not a privilege.
It shouldn't be a system where your access to life-saving treatment hinges on your ability to navigate a bureaucratic maze or fight a corporate giant.
It's about real people's lives.
It is.
It's the widow grieving her husband, the family facing bankruptcy because of a medical emergency, the individual denied a treatment they desperately need.
Their stories are a powerful reminder of why this issue matters so deeply.
Yeah.
It's about human dignity, compassion, and ensuring that everyone has a chance at a healthy life.
Regardless of their financial situation.
It makes you wonder if other developed countries have managed to create these more equitable healthcare systems.
Right.
What lessons can we learn from them?
That's a crucial question.
Yeah. Are there models out there that we could adapt
I think so.
to the American context?
We often get so caught up in the complexities of our own system that we forget to look outward.
Yeah.
There's a wealth of knowledge and experience to be gained from looking at how other countries have tackled these similar challenges.
And it's not about copying and pasting solutions.
Right.
It's about analyzing what works, what doesn't, and how those insights could inform our own path towards reform.
What's fascinating is that many of these systems prioritize preventative care and early intervention.
Interesting.
They recognize that it's not only more humane, but also more cost-effective in the long run.
So it's a shift in perspective.
It is. From treating illness to promoting wellness.
Exactly.
That's a pretty powerful idea.
It is.
But it requires, I think, a willingness to challenge our long-held assumptions about the role of government, private industry, and individual responsibility.
It's about reimagining what a healthcare system can be.
Yeah.
Moving beyond this current framework of profit-driven models and embracing a more holistic approach that prioritizes the well-being of all citizens.
So where does that leave us? We've covered a lot of ground here.
Yeah, we have.
You know, from the heartbreaking stories of individuals denied care to this complex history and these systemic issues that have kind of led us to this point.
Right? It can feel overwhelming.
Yeah, it can.
You know, when you start to really look at the scope of the problem.
But the important thing is this conversation is happening.
It is.
Awareness is growing. And there's a real push for change.
Yeah, there's a recognition that this status quo is just not sustainable.
It feels like we're reaching a tipping point.
I think so.
You know, the anger, the frustration, the demand for something better, it's all kind of converging.
Yeah. The question is, how do we channel that energy into meaningful action?
Yeah. What are the next steps here?
Well, it starts with education.
Okay.
We need to keep talking about these issues, sharing the stories, delving into the complexities of the system.
Right. And not just passively learning.
Right.
It's got to be active engagement.
Exactly.
It's about contacting our representatives, supporting organizations, working for reform.
Right.
Even having these difficult conversations with our families and communities.
Yeah. Those kitchen table conversations can be really powerful.
Yeah. And that brings us back to the event that kind of sparked this whole discussion.
The killing of Brian Thompson.
Yeah. Such a stark reminder.
It is.
Of the raw emotions surrounding this whole issue.
And while violence is never justified, of course, understanding the despair and the desperation that might have fueled such an act can help us channel that energy towards constructive change.
Transforming anger into action.
Yeah.
Turning pain into purpose.
It's a call to recognize the human cost of this broken system.
Yeah.
To see the faces behind the statistics and to fight for a future where everyone has access to the care they need.
Regardless of income or zip code.
Absolutely.
So as we wrap up this deep dive, I want to leave you with a question to kind of ponder.
Okay.
If healthcare is truly a fundamental human right, how can we create a system that actually reflects that value?
Right.
A system that prioritizes well-being over profit, compassion over bureaucracy, and ensures that everyone has a chance at a healthy life.
It's a challenging question, but one worth wrengling with.
It is.
And ultimately, I don't think the answer lies in finding this one perfect solution.
Right.
But in continuing to ask these tough questions, engaging in this thoughtful dialogue, and working together to create a more just and equitable healthcare system for everyone.
Thank you for joining us on this deep dive.
It's been a pleasure.
Keep asking those questions, keep the conversation going, and keep pushing for a better